Welcome to Sports Medicine Weekly on 670 The Score, your on-air resource for fitness, nutrition, and injury prevention and treatments for today's weekend warrior and professional athletes, with renowned specialist of elbows, knees, and shoulders, Dr. Brian Cole, along with other health and fitness leaders, and your host, Steve Cashel, right here on 670 The Score.
And good morning, everyone. Welcome into a brand new edition of Sports Medicine Weekly on this Sunday morning. I'm Steve Cashel, joined by my usual co-host, Dr. Brian Cole. He is the head team physician with the Chicago Bulls, one of the team physicians with the Chicago White Sox, sports medicine specialist, orthopedic surgeon from Midwest Orthopedics at Rush. Our website is sportsmedicineweekly.com. And Dr. Cole, right off the bat, very sad news in the Chicago sports world this week. We lose one of the great ones, one of my idols growing up in the 60s and early 70s when I was growing up in Park Ridge. Gale Sayers, the great Bears running back, passes away, and electric runner, so much fun to watch. But, of course, his career was cut short by knee surgery and the knee injury. My question to you this morning, Dr. Cole, is how has science changed? And if Gale Sayers was playing these days, might he have had a longer career?
It's a great question, Steve, and I know it's been on some people's mind because when you think about Gale Sayers, you almost have this impression like he had this, 10-year career. And it was a really short career. I think it was a total of like 68 games. But he was one of the greatest running backs of all time. And I would say that when you look at, he had an injury, for example, where he had one in, I think, 1968 and then one in 1970. And it's the one in 1970, I think, that really was the pivotal one. But on one of those injuries, for example, he was operated on the same day or the same evening. And that was by Dr. Theodore Fox, actually, in the late 60s. And essentially, what we used to do, and I shouldn't say we. I think I was 7 years old at the time. What was done is that they would fix the ligament on the inside of the knee, the medial collateral ligament, with a staple. They wouldn't fix the ACL, and then they put him in a cast for 6 to 8 weeks, and it would basically turn the leg into cement that you'd have to rehab for months to get out of that. And
wow.
We now would, it's crazy. I mean, we now wouldn't operate on the first day. It'd be very rare that would happen. We often don't ever treat the medial collateral ligament with surgery, and then we would treat the ACL when the knee has full motion and no pain, typically 3 to 4 weeks after the injury, and there may not be any deviation or shortening of an individual's career. So it was pretty archaic, and we've gone sort of 180 degrees to what we used to do. And, he was, at the time he injured his knee was around the time that we started to do ACL reconstructions. And it was being done in Germany in some format. There was some soft tissue operations that aren't exactly like we do today. But it was really the early 1970s, had he injured himself then, that we were starting to do these procedures where they're just like we do today, maybe a little more elegant or minimally invasive, but we could do a good operation in the early 1970s, but it wasn't routinely done in the late 60s, and unfortunately he was treated with immediate surgery, give him a staple on the inside to stabilize it side to side, and throw him in a cast, and unfortunately we just weren't there yet at that time, and that was the result.
Yeah, and one reason, Dr. Cole, from what I've learned in this show, and even with the Derrick Rose injury, with my time with the Bulls, the torn ACL, the reason you don't do surgery the night of, you kind of let that swelling go down. Is that the main reason?
Yes, because there's a risk of getting postoperative stiffness if we operate too quickly. I remember, even when we were, timing Derrick's surgery, I was, being asked, well, why not just do it, get him rehabbed on the other side, take advantage of time. If you rush the surgery, the incidence of stiffness goes up by 10 to 15%. If you wait it out, then you get a quiet knee. They're not swollen. They have full range of motion. They have good quad control, and the risk of postoperative complications related to stiffness goes down to less than 5%. So the timing of surgery is really important, and you don't really want to do it on the heels of a recent injury.
Okay, let's move on. And Dr. Cole, we've got a great guest on the line. Very interesting story. Let me set this up if I can. We're going to interview a gentleman named Daniel Fells. Played 10 years in the NFL with 7 different teams. And very interesting, a tight end who suffered a chronic ankle injury, turning out to be a methicillin-resistant Staph aureus infection. That type of infection, also known as MRSA, largely resistant to antibiotics. 7 surgeries to get Daniel's infection under control. At one time, doctors informed him that amputation may be required. So, wow, quite a story right here, Dr. Cole.
It is, Steve, and we've had a number of MRSA infections in the past in the baseball training room, and we've had it in the NBA training room. So there are procedures in place now that we didn't have a long time ago. You know, they used to share bars of soap and towels and things like that, but it's now there's sort of universal precautions largely because of this exact issue, which can be devastating and unfortunately shorten an athlete's career.
Well, Daniel, thank you so much for joining us from California this morning, so you're up early, but really appreciate you being here on Sports Medicine Weekly. Can you, I kind of summarized the story. Tell me how it was from your angle.
Oh, man. Well, first off, thank you guys for having me on. As you said, I played 10 years in the league, and I felt like I had a lot more left in the tank. But, I ran into my kryptonite. I like to say I was, in my prime and in the best shape of my life, and coming off of a decent year the year prior to, and I had high hopes for that following year. And then 3 weeks in, I ended up in a hospital over 18 days, had 7 surgeries while I was in that hospital. The doctors had mentioned amputation if we couldn't get the infection under control with all the antibiotics that I was on. They just couldn't figure out the right combination to kind of get this, put this thing at bay. And, at one point, we thought we stopped the spread of the infection, and then it was in my lungs. So I had spores in my lungs with infection, and so they thought it was in my bloodstream. Or they had to get there through the bloodstream. So they had to check my heart and everything, and by the grace of God, I made it out of that. It wasn't in my heart. But yeah, after 18 days in the hospital, I was finally released, went home, and I was on intravenous antibiotics for 14 weeks, had 3 more surgeries to kind of clean out the area. The infection got into my tibia, so they had to remove. And yeah, it was quite the ordeal that has left me still scarred today.
Daniel, did you get this infection without surgery? In other words, it wasn't a surgical infection. It was you got a MRSA infection, and then it required 7 surgeries to eradicate or get rid of it. Is that what happened?
Yes. As you know, Doc, I don't know exactly where I got it from. There's no way of actually going back and testing where I got it from.
But it was pre-surgery, though, right? It was before you had an operation?
Correct.
Got it. So did your ankle joint get infected, and that led to all the treatments you had?
I believe so, yeah. So yeah. I had an arthritic ankle and whatnot, and just had some pain one morning, and that pain grew into a serious infection. There was no sores or anything like the typical, appearance that there may be an infection on the outside of the skin. But after having my ankle aspirated in the hospital, after I couldn't really walk on it, they found that I was septic.
We're visiting with Daniel Fells, who played 10 years in the NFL before MRSA wiped out his career in 2015. Dr. Cole, what's your experience with maybe how MRSA sets in?
Well, what's interesting, Steve, is that a lot of us are what we call colonized with MRSA. In other words, if we were to swab the nose of every individual who comes in, say, for surgery, many of us are kind of walking around with this and just don't know it. And it seems to be what we call an opportunistic infection. In other words, there's some glitch or vulnerability that leads to someone getting infected, and they don't know how. Like Daniel said, it could have been in his bloodstream and then seeded his joint. And one of the issues is if you have an arthritic joint, for example, it's almost like a feeding ground, and all it takes is brushing your teeth or some aberrant, single bacteria lodging itself there, and then it's a favorable environment to start dividing. And it's not really on anyone's radar because it's so common in terms of being in our environment. It's on tons and tons of surfaces, but it takes a host, meaning the patient, to actually allow it to take over. And there's a lot of, unfortunately, there's a lot of stories like this. I think we've done better now because we've identified that it can be, when you think about people in the locker room and all the things that are shared and so forth, and obviously this is another, things are going to change moving forward because of COVID. But, we used to share bars of soap and brushes and combs and all that stuff. And now when I think about it now, it seems kind of gross. But back then, people didn't give a second thought about sharing a bar of soap. It's soap, for God's sakes, right? So it didn't seem like that was a problem. But now everything is totally different, and it's even gotten to the point now where the way they handle laundry and dirty clothes, for example, is handled differently because of the MRSA. So we haven't eradicated MRSA, but I think I haven't, knock on wood, seen an infection for a very long time. The other time way we sometimes see it is someone gets sort of a boil or like a pimple or something like that, that it takes off into a formal MRSA infection. But the kind of infection that Dan has, we were really familiar with. We've seen it in all the different locker rooms. You see it in the college setting, but I haven't seen it, thank goodness, in the locker room for a very long time in this exact fashion.
Again, we're visiting with Daniel Fells. I'm Steve Cashel with Dr. Brian Cole. You're listening to Sports Medicine Weekly on this Sunday morning. Daniel, who played 10 years in the NFL with 7 different NFL teams, had his career wiped out with MRSA in 2015. And by the way, a recent CDC study found that linens or soft surfaces are especially ripe for infection spread, much more than hard surfaces like door handles. The recontamination threats that textiles pose cannot be solved with common laundry detergent or bleach. The minute they're pulled out of the dryer and moved to a locker, a room, or onto a person's body, they become contaminated, so leaving a significant void in any infection prevention strategy. And Daniel, I know there's now a product. Tell us about this one, SilvaClean, an antimicrobial product that used to clean laundry and prevent the spread of the disease. This is something that I know 6 NFL teams are using. And tell us more about that.
Yeah, of course. So, obviously this is something that's near and dear to my heart. As Doc mentioned, like infection prevention has never been more important than it is now. Everyone's paying attention to hygiene and cleanliness now, especially with COVID-19 wreaking havoc on our world. These dangers have always existed, and now I've turned my focus to eradicating them from sports to start with. Obviously we want to get it eradicated from the entire world, but my mission is to prevent what happened to me from not happening to anyone else in any sort of in any sort of fashion, right? So this company, Applied Silver, they have this amazing product. It's groundbreaking technology. It's unlike any infection prevention technology that exists today. In fact, the EPA has certified it as the only technology of its kind. And so what it does, it's an infection. It's a disinfectant that kills germs once. Most disinfectants kills germs only one time. It's like an instant kill, like bleach or something like that. SilvaClean, this product is a continuous kill. It kills germs the moment laundry comes out of the dryer, making recontamination non-issue. You can touch it, you can sneeze on it. The silver ions that are infused into the fabric once you use the SilvaClean product, they're constantly killing any germs that come into contact with it.
It's interesting. Silver has this natural antimicrobial effect. We're using silver, for example, in surgical dressings, embedded in surgical dressings. Other similar things that have these properties have been looked at to use on top of implants that we use in orthopedic procedures. This technology is pretty cool. I'm interested. Can you explain, without going into too much detail, is this something that you put in we have these huge washing machines, for example, at our training facilities to wash, lots and lots of heavy duty stuff after a game or after practice. Is this something that you adapt a laundry machine to? Is it something you toss in the machine like a pod? What is it?
So what it does is it adapts to the commercial washing machines at the moment. Obviously, we're working on trying to get this on a grander scale, but in the meantime, it connects to commercial washing machines. It adapts to the systems that are currently used that dispense the bleaches or whatever detergents or whatever chemicals you're putting into these washing machines. SilvaClean will adapt to it seamlessly, and it is integrated through the rinse cycle, which it protects. It coats all of the clothing or whatever textiles or fabrics you have in the washing machine, and in turn, when they come out, they are antimicrobial.
And how long does it last for?
It lasts pretty much indefinitely. Obviously, it will last throughout until the next wash.
Got it.
So, every time that it goes back in there and gets re-washed, it is reapplied every single time. But, we have things in storage that were treated, years ago, and the efficacy level is still, off the charts.
Is it like a liquid that you pour in, or is there actually a mechanical aspect that has to distribute, silver to the process?
There's actually so we have like this actual unit that dispenses it. But imagine like an IV bag. That's the actual solution. So there's not a high dosage that needs to be implemented into every single cycle. But the science behind it and the technology and the smart people who designed all that and discovered it could probably give you a better insight into exactly how much and how it goes in there. But like I said, it's one of a kind.
Who's using it now? You have some penetration now into the NFL and NBA and so forth?
So we have, let's see, it's been adopted by several NFL teams, teams including like the 49ers, the Saints, and the Cowboys. Obviously, we're trying to push it further and trying to get into every single NFL team, NBA team, every sports team. We over the past 2 seasons, we've collected data from the Saints and the 49ers locker rooms, and that data has shown a drop in pathogen levels to 0. That's just incredible, right?
Great stuff. And is this final question, again, visiting with Daniel Fells, who's talking about a new product called SilvaClean, used to clean laundry, prevent the spread of MRSA, a disease that's largely resistant to antibiotics. Is this something that our listeners can use at home, Daniel, or mostly for the professional and college and maybe high school sports teams right now?
In the current state that we're in right now, it's for the professional teams, for the hospitals, the hotels, things of that nature. We are developing, trying to get this thing into every household eventually, right? It's a fairly younger company, so we're developing, we're moving forward, and we will try to get it in every household. But in the meantime, we're on the bigger scale right now.
Fantastic. And, hey, final question, Daniel Fells. You played 10 years in the NFL. Congratulations on your career. Sorry it was cut short by MRSA. But how are you feeling these days following all those surgeries?
I appreciate it. I'm okay. Mentally and physically, it took me several years to kind of get back on my feet to just kind of walk up and down stairs, and mentally, wrapping my mind around my career being done and trying to figure out the next chapter of my life. It's been tough, but by the grace of God, I'm here. I have my wife and I have my 2 kids, and we're doing remote learning like so many people across the country, and I'm definitely fortunate in that sense. I just wanted to add, it was such a whirlwind for me, and so many people are so familiar with the story of Alex Smith right now. And how he had the devastating injury, and he's the most prominent example of an infection gone wrong. And I was reading that doctors found some dirty sock in his wound. And it's incredible. They found traces of a dirty sock in his wound, and I can't help but think, if SilvaClean were used, whether it's in the house or in the locker room or wherever it was before he put the sock on, would this infection have ran rapid as it did?
Wow, so, great stuff, Daniel. Yeah, it's a great story to tell, and really appreciate you joining us, and continued good health on your end, and good luck with this new product that obviously is making a difference out there for everybody.
Thank you so much. I appreciate you guys having me on.
That's Daniel Fells, former NFL player. We're going to take a break right now in Sports Medicine Weekly. When we come back, it's our Ask the Doctor segment. Stay with us, only on
670 The Score.